in Memphis, and she has done great work in this area. We have tried to look for people who do this work in their expertise, and Susan has been doing this work for quite some time now, and I'll allow her to give a little bit more introduction of who she is. So I will pass it to you now, Susan. Thank you.
Okay, well, thank you. I am, as she said, I'm Susan Neely-Barnes. I have my MSW and my PhDs in social welfare. I'm professor and director of the School of Social Work at the University of Memphis, and I teach a number of different areas, including program evaluation, practice evaluation, research, statistics, grant writing, and many others. And that's my total right there on the screen in terms of my total amount of grant funding, and most of it is through training grants for students, but I've also done some other types of research grants as well. And so, like as she said, I'm hoping to talk about formulating your project idea so that it results in measurable outcomes and some strategies around outcome evaluation. And I wanted to start today with two of the best pieces of advice that I think I've ever received around grant writing in general. The first one being that need is everywhere, and there's never enough money to meet all the need that's out there in the community. So you want to argue the impact of your idea, not just the need, because grant funders will get lots and lots of proposals with arguing that there's a need for this or there's a need for that. But the ideal grant proposal argues for an idea that costs a reasonable or a little bit amount of money but makes a tremendous impact on a problem. The second piece of advice is, that good writing is essential. And I was in a grant training 15 years ago, and somebody made this statement, and it has always stuck with me, and it's really helped me as I was writing grants. And that is, a good grant proposal convinces the reader that this idea absolutely must be funded, and it must be funded right now. So you want, when you write your grant and you submit it, you want it to be that compelling, that you want people to feel like that this one stands out, it absolutely got to be funded, and right now. Was somebody trying to say something? Okay. All right, so this is your first opportunity to be a little bit more interactive, and you can be interactive on the chat, or you can turn your microphone on and speak if you would prefer. I've taught a lot of online classes, and we communicate either way, so whichever way you want to communicate is fine with me. But this is from a book by Carson Fox, and I have two books that I've taught grant writing from that I'm going to recommend to you, and they're both reasonably priced. They're not priced like textbooks, and you can get them on Amazon. And Carson Fox's book is called The Only Grant Writing Book You Will Ever Need. And they did, to prepare for writing their book, they did a series of interviews with granting agencies. And these are 3 quotes from 3 of those grantors. And so these really stuck out to me. So 1, we are moving from a funder mentality to an investor mentality. We're asking ourselves, what do we really want to buy? Is this the best? Yes. Is this the best use of our money? And the second one is, I want to see a deeper impact on children's lives. Did you actually keep children out of a gang? And a third one, in a downturn or an emergency, money feels twice as precious. And I want to make sure that best practices are being utilized by our grantees. And so in this third one, this book was written initially after the last economic downturn, after 2008. But I thought, how relevant is this quote even today when we've just suffered through the COVID crisis? So what strikes you about these comments, and do you see the relationships to measuring outcomes?
Hi, Kim Moss.
Hey.
Well, I would say, the second one about the gang, at least that one is measurable, because
Yeah.
it might be self-reporting from them, but at least that's something you can tell. This many children were in gangs, and then after a period of time, this many were not.
Absolutely. That's what I see there too. I see that very much about outcomes that, we want to know, did it actually work? Anybody else want to chime in and add anything else?
Hey, Ray Rico here. I think from the funder versus investor mentality, it definitely presents value as you present your plans as someone investing in it, not just your plans, but also how you can contribute to the community. So I liked seeing that in the first bullet. I like that a lot.
Yeah, I agree. Yeah. Yeah. So I think this for me really frames like how we need to think about, and I've tried to move my students, it's always a challenge for them, but to really think about if you're not making an impact and if you can't convince your reader that you're making an impact, then you're going to have a hard time getting funded. On the next slide, let's see if I can, this advances a little different. I'm used to using Zoom. Okay, so what we know, unfortunately, and I think all of you are doing HIV work and you can give some examples from your own work, but unfortunately, we know that some interventions are ineffective or they're not effective. And so, thinking about a few that have been demonstrated to be ineffective, abstinence-only sex education, Scared Straight, which you may know about, which was a program that was supposed to prevent juvenile crime, right? And like it was tours of prisons and kind of scaring kids away because of prisons. And it was found that it actually did no good, and in some cases maybe did more harm than the alternative of not doing that program. And then the DARE program, interestingly enough, which was years ago, which was a drug education program in the schools. Research evidence suggests that it wasn't effective, but not everything that we do is effective. And so just the idea of throwing money at a problem is not always the way to go, because we need to make sure that we're doing something that's effective. Like we said in this last slide, there's only so much money to go around, and we want to make sure that we're putting out ideas that are effective. So all of this to say that measurement of outcomes cannot be an afterthought when planning a grant. We need to plan with our problem and our ideas from the beginning of how do we measure these ideas. And then the question of what should we measure, and I was hoping for some discussion here. When you're thinking about what we measure, the number of people served, satisfaction with services, whether the program achieved its desired result. What are your thoughts about those? Thank you to the other two people who chimed in last time. Should we measure all of these? Oh, I see a comment in the chat. We'll pull that up. Impact seems more relevant. Yeah. So I am always working with students in my grant writing and my evaluation courses. There's students who are graduate students who will go on to be social workers in the field. And we tend to see this a lot. And the funders in this community have said to me that they see a lot of people who don't understand outcomes. And what we tend to see oftentimes is people think, well, I'm just going to measure the number of people we serve. And I'm not saying that that's not important, because of course you want to know if your program had a broad reach. But if we just measure, did we serve people, then we don't know if we served them effectively. And so we want to go beyond how many people did we serve to whether the program achieved its results. And then the same with satisfaction. Satisfaction can tell you some things about whether someone is likely to stay in a program. If they don't like it, they might not stay in it and they might drop out, which would lead to it being ineffective. But you don't want to stop just there. You want to know whether the program achieved its result. Okay, so a good evaluation, of course, is going to start with a good understanding of the problem. And this is, like I said, there's two books that I really like. I'm trying to move this little box around so that it's not in our way. There's two books that I really like, and this one is called Grant Writing Step by Step, and it's by O'Neill McElrath and two other authors. And they have a whole series in their book of exercises that you can do as you're planning your grant proposal. And I thought we might start with this one. And this one, they have you break down your problem into who, when, where does the problem occur, what, why, what is the evidence for the problem, and what is the impact if the problem is resolved. So, for example, in their book, in O'Neill McElrath and colleagues' book, they use an example called Allison Eats, and Allison Eats is probably based on a real food pantry in a town that they made up the name, I believe, called Allison. And Allison, this food pantry serves the south side of town. And so their who, where, and where is that there are about 130,000 people in Allison, or approximately 13% of Allison's population that lives in hunger or is at risk of hunger. And they demonstrate this through data from the Census Bureau and a recent survey from the Allison City Council. So again, important to have data to demonstrate your problem. And then their mission is to reduce hunger in the community. So if the problem is resolved, we would see a reduction in hunger in the community. So I did my own example here. I have a training grant right now called the Mid-South Social Work Scholarships for Disadvantaged Students, and it's funded by Health Resources and Services Administration, which is a federal agency. And it is just straight up scholarships for students who qualify under the federal definition of disadvantaged as either economically disadvantaged, environmentally disadvantaged, or educationally disadvantaged. And so when writing this up, my who, when, where was about 42 students in the MSW program per year. What, why, around 2/3 of MSW students qualify, or for that 42 students a year translates to about 2/3 of our student body who qualify under at least one, if not more than one, of those definitions of disadvantaged. And then to demonstrate that, we use data from our institutional research office, which they pulled it from the FAFSA, which is the free application for federal student aid. Almost all of that data came from the FAFSA, but it was really important to work with them, to work with that office and present that data in such a way to make the case that we were a good bet for HRSA to fund because we have such a large population of students who can benefit from this funding. And that we have a need for more social workers in this community, and our graduates who, people who graduate from our program tend to stay in this community, so that we were making the case for why HRSA should fund us. And what we hope to achieve if the impact of the problem is resolved is a dramatic reduction in the amount of student loan debt for these students and more students completing the MSW program. I'm sure now that I have the grant that I have people who've decided to come and finish their degree because they know that they can access the scholarship money. So what I was hoping that you would do in small groups is to take your idea, because it's much more fun to train if you understand what people are working on now in terms of the grant that they will be writing, and to think about filling in this table yourself with who is in need, where are they, when is the problem evident, then what is the specific problem and why does it exist? What evidence do you have to support your claim, and what will occur if the needs are met and what is different? So try to see how many people we have participating.
We have 15, Susan.
We have 15. So do you want to break them into maybe 3 groups? And do I need to stop the screen share?
I don't think so. Hold on a second. Let me go.
You won't be able to see this screen when you go into groups. So if you want to take a second to jot down some of these questions: who, when, where, what, why, what's the evidence for the problem, and what's the impact if the problem is resolved. And I was thinking that we could spend about 10 minutes having you discuss in group an example, if anybody's working on their grant application now, or any example you want to use, and kind of laying that out. And then hopefully there'll be somebody from each group that will agree to report back.
Okay, you ready for me to break everybody out?
Yes, let's do it.
Okay, here we go.
And I think you're going to have to select to join your group when you see it appear on your screen.
Can everybody see their breakout group? Just give me a thumbs up or. Can you hear me? Krista says no. Who else?
No, this stays.
No, it's not working. Wonder if I stop screen share, if that'll help.
Maybe, because I can see it on my screen. Amber, you're not
Yeah, I
in the
don't-
group.
I can't see anything about breakout groups.
Huh. Well, wonder if I can. Isn't it supposed to notify them?
I thought it was working yesterday.
Yeah, and I
But
can see them.
yesterday when I was host, I could see the option to create them, and I don't see it today.
Let me start it and see
Oh,
if
I
that
see it now.
does that work? Okay.
Did
Can
everybody
everybody
have?
else see it?
Yeah, they're all going into groups.
Okay. Good.
So should we pull them back at noon exactly?
Sure. Sounds good.
Okay.
Mm. I'll just have to keep time. Okay. You're all set.
All right. Well, I can watch the time too. We had a couple of people who didn't join their groups. Sherry, are you able to go in the groups and tell them to come back in 2 minutes?
Sure, I'll try that. Okay, I'm bringing them back now.
Thank you. All right, so welcome back, everybody. So for the sake of the folks who are organizing this, did you find it helpful to do great breakout groups? Were you able to discuss in breakout group? Thought I saw somebody nod their head. You can
Yes.
either say yes. Yes,
Thumbs
did you
up,
work?
thumbs down.
Yeah, so Ray is responding yes. Anybody else? Okay, thank you, Krista. All right, so let me go back to sharing the slide. Let's see. So does anybody want to either in the chat or well, if you can turn your mic on, that's probably best. If you had one idea that came out of discussion that you would like to offer for us where you worked through a problem example.
I won't be shy. I'll go first. This is Ray. We had Friends for Life, Alliance Health, and St. Jude folks on in our group. But I think one of the things we identified was that our general population would be persons living with HIV who are not virally suppressed to be our primary goal and make sure that we're addressing the at-risk folks. I think through working through the problems, we found that mental health and mental wellness have a big part in that with one of the organizations that were in our group. And we get that information from our caseworkers. We talk about it with the data that we get from the Tennessee Department of Health. So that kind of helps us navigate it that way. I think being able to hone in on zip codes and understand where certain geographic areas where there are higher incidents of transmission definitely help some of the folks on our group identify need. And I think one of the biggest things that I took away from listening from the group was that, education, knowledge, making folks aware, having outreach programs so that you can fulfill not just your impact of what you're doing in your program, what you're doing with your grant, but also helping people live longer and have a better quality of life. So that was my general synopsis of our group.
That is an awesome example. I really like, in terms of the first three, that needs assessment that needs to happen in terms of where are those people living. Yeah, thank you, Aisha, for the clapping hands. Where are those people living who have that issue of not being virally suppressed? Like, what percentage, the question that popped into my mind as you were talking is, what percentage of the population of people living with HIV fall into that category of not being virally suppressed? I think, am I using the terms correctly? I'm not I know some about HIV. It's not my out knowledge area. So I'm sorry if I'm not. But what percentage of that population, what percentage of the population of people who are HIV positive are living with that? And then I think the next piece again is like, what interventions help those people follow their treatment better? I'll give the example that, when I first started teaching social work students and I found out that we place social work students in the dialysis clinics, And I had just come through my graduate programs. That wasn't something I was introduced to. I was like, wow, that's really interesting. Why do we place social work students and have so many social workers in dialysis clinics? And it's because there's so many things that get in your way when you're in dialysis of following your treatment protocol, that they were helping people manage the challenges in their life that get in the way so they can be more successful in dialysis treatment. I think that what you're describing here probably is a similar population with similar issues. And so I think the next step is what intervention, I don't know if you have a thought about that, but what intervention would be effective to help those people move from not being virally suppressed to being virally suppressed. Is that the question?
We did talk about that and how the continuum of care would help with getting folks living well, keeping them on their medication, and then also kind of closing the loop and having prevention as a component too. So we kind of touched on that. We didn't have a lot of time, so I kind of was pushing us through quickly, but we did mention, I know Kim talked about the continuum of care and making sure that you have access points for all.
Yeah, so I think, you have potentially lots of different ideas there, and to have one proposal, you kind of have to hone in on, are we going to focus on the prevention piece? Or are we going to focus on the continuum of care piece? And then you get to, outcomes. Is there another group that wants to volunteer? That was an awesome example. I know it might be hard to follow that, but is there another group?
Ace, do
Okay.
you want me to talk about our group?
Yeah,
Sure.
I was just gonna say we could share ours.
Okay, it's your vision, so you go forth.
Okay. So hello everybody. We had this breakout meeting was actually really really good exercise.
And so I have the notes, so I'll just actually drop them into the chat real quick. And that way everybody can kind of see a rough draft of the idea.
Okay, great.
Let's see. There we go. So if you kind of want to, the name of the organization is Plus Memphis. And Ace, if you want to describe the what's first, and then the details can follow.
Okay. So the specific problem that we're having, that we want to address is individuals who are HIV positive, a support group for them, kind of similar to what you mentioned about individuals who were in the dialysis clinic. There's often so many that impede your treatment. And so that's kind of where we want to go with the support group, but we want to spin on it and make it a mobile support group where we bring, not only will we bring the services to you, but we also train the clients to the, for individuals who want to come to the support group. Let's say, for instance, we're holding in a large enough space, everything with COVID and everything going on, we're holding in a large enough space that'll allow us to, we'll be able to transport the individuals to the support group to get the resources, to get the information, to get the support that they need, and then transport them back.
Yeah, that's great. I really appreciate these examples because this will help me as we get into, we have 50 minutes left in this per training, but as we get into writing objectives, we can really start to think about how did these problems lead to objectives. And since we have 50 minutes, I'm going to keep going. I'm sorry if I didn't get to the, well, is there a third group that wants to say anything quickly about what their project, what their example is of their problem, so that I don't leave them out? Okay, well, I'm going to keep going, and then you can chime in at any time that you want to. So I have to make sure that I can, okay. So we're going to move on to writing goals and objectives just to make sure we don't run out of time. So when thinking about goals and objectives, your goal is your broad and general statement about what you want to accomplish. And then objectives are your more narrow, specific, time bound. So when we think about goals, you know, these are our big ideas that maybe we won't fully accomplish, but where we're moving towards. So one, all children have a playground within walking distance. For mine, thinking about my training grant, eliminating student loan debt for MSW students. I went ahead and wrote in here, ending in the HIV epidemic, thinking about, I think that is the title of this program, is around ending the HIV epidemic. And so you might think of that as the goal, or preventing new infections, or having 100% compliance with HIV treatment. You know, something like that would be your broad goal. I was going to have you take some time to write goals, but I think that we've kind of covered it. So I'm going to move on to objectives because I think we should spend more time on objectives. So objectives are your, so there's this acronym SMART, which is a SMART objective. A good objective is a SMART objective, and SMART stands for specific, measurable, achievable, relevant, and time bound. Okay. So I have some, in my next slide, I have some do's and don'ts, and then I have a whole bunch of examples of objectives. So whereas your goal was very big and broad, your objective is going to be something that you can actually accomplish within the bounds of this grant proposal. All right. So some do's around objectives include at least one goal for the project and at least one or two objectives. And I didn't put a don't in terms of the maximum number because I think that I've seen different proposals that have different numbers of objectives and they all work. And it depends on the size and the scope of your grant. So I had some students write some proposals where they had 16 objectives and they all made sense and they were all relevant. So I said, okay, that's good. I've seen somewhere, you know, they only use the one or two. You want to make sure that your goals and objectives tie back to the problem statement. So if the problem statement is around the lack of support that the community has, so we talked about one that was like a lack of transportation, a lack of resources in the community where the population lives, then you see where you're going towards an objective around addressing that specific problem and bringing those resources to that community successfully and being able to measure that. You want to include all relevant groups and goals in the objective statement, and you want to allow enough time to successfully accomplish the objective. What you don't want to do is overpromise what you can accomplish. This is from the O'Neill and McElrath book again, and they recommend that you underpromise and overproduce, so that it's better to underpromise and overproduce than to overpromise what you can accomplish in the scope of a grant and not be able to do it. You do not want to confuse the activities with the objectives. And I see, unfortunately, students do this all the time. So example, running a food pantry is an activity. So running the transportation successfully is an activity. Running a community group where people come to, you know, get support they need who are HIV positive, that's the activity. Actually having those people comply better with their treatment so that they are virally suppressed is an outcome. So you want to make sure that you focus on the outcome in your objective and not just the activity, right? And again, I find that this is very hard for people. I see people do this over and over again where they get focused on what a program are we going to run and not, okay, how is this program that we're going to run leading to an actual change? Here's an example that is better, ensuring that at least 3,000 households reduce their risk of hunger over the course of the year. That's an objective. All right, and don't forget that evaluation can need a budget. So if you're going to measure a difference, a change, some of the measurements that you might use might need to be purchased. So make sure that you think about that. If you're going to hire an external evaluation, what is that going to cost? And also make sure that external evaluator is involved early enough that they can look at your plan for collecting data and make sure that they can do an evaluation based on that plan. One of the things that people often forget to do is if you're going to do a pre-test, post-test, for example, they forget to save an identifier so you can link the responses from the person at pre-test to the responses to the person at post-test. And that very much, if you're not able to do that, that limits your ability to run a statistical analysis. So make sure that you have a budget for evaluating and make sure that you have set up your plan for data on the front end. The other thing that we've seen quite frequently in the community that bumps up against the ability to do a good evaluation is missing data. So like I've talked to colleagues who work in this field around HIV that they said, you know, this agency said to me, we have all this data that's on this form, and I go in and I actually talk with them. And then the people who are working in the agency are routinely skipping like several of these questions so that they have almost no data on these particular questions. And then those were critical to the analysis I was going to do for them. So those kind of things need to be addressed. These are some examples of objectives from one of the training grants that I submitted. And I think this is from the new one. I have another training grant that is for training MSW students in integrated behavioral health. And we just submitted a renewal. And so here's examples of some of our objectives. The first one, increase the behavioral health workforce in Memphis and the greater Mid-South. The second one, improve trainee skills for practice in integrated behavioral health settings. And the third one, improve trainee skills in substance abuse treatment and opioid addiction. Now for this particular grant, they had us do a table where we linked the objective to the person who was going to be responsible. Somebody's saying the sound went out. Is everybody able to hear me? Somebody's saying in the chat. I didn't hear that person. Okay, Kimberly is still saying yes. Anybody else? Okay, somebody else is saying I hear you. Okay. So examples, okay, so we had a table where we were going to link the objective to the person responsible to the way that it was going to measure and then the time frame for measuring that objective. So increase the behavioral health workforce in Memphis and the greater Mid-South. That one, we're just counting up the number of students that we trained. And so that one was pretty straightforward. Improve trainee skills for practice in integrated behavioral health settings. So this one, we have a scale called the team skills scale. And so we give that before the training program and at the end. So we have a pre-test, post-test set up. And then of course we said, you know, who is responsible for making sure that we give that. And then improve trainee skills in substance abuse and opioid addiction. Opioid addiction is a big priority for HRSA. And so we have two scales that we are using for that. One is about opioid stigma, and the other one is about knowledge of opioid use and addiction. And so we give that at the beginning and then at the end to see if that there's improvement in training knowledge. Okay, here are some examples again from the book by Carson Fox. And you can see these are long and they're a little bit wordy, but the point is that by the time that you read this whole objective, you know exactly what they're going to measure, when they're going to measure, and you can be convinced that they have a plan that will tell them if improvement has happened. So this one is about improved behavior. By the end of the first 6 months of the project, participants in the after-school basketball project will demonstrate improved behavior in school as a result of project requirements and activities, as measured by incident reports and teacher observations before the league starts and 6 months later. So like I said, it's a little wordy, but we can see that they're focused on improved behavior, and we have a plan for measuring improved behavior. It is teacher observations and incident reports. All right, and then the second one, reduction in violent instances. By the end of the basketball project, participants will demonstrate a 50% decrease in violent incidents as measured by school incident reports. Again, specific plan for measurement, and improved school attendance. By the end of the basketball project, participants will have 40% better school attendance record than classmates who did not participate in project activities. So this is an exercise, and I think since the breakout groups went well, let's do it again. And I will shut this down in a second. We can go back to breakout groups. But this exercise, again, from the same book that the other one was from, helps you to create your objectives. And so they say that you go through these 5 pieces. What is the direction of change? What is the area of change? What is the target population? What is the degree of change? And what is the time frame? So again, using their Allison Eats example, which is that food pantry in the south side of the city of Allison, they want to increase food availability, or you could also frame that as reduce hunger. Either way would work. They want to, the area of change is for the residents of the city of Allison south side. The target population is families who are hungry or at risk of hunger. The degree of change is 9,000 boxes of food totaling 144 meals that will reach at least 3,000 households. So very specific there. And then the time frame for this grant is 1 full year. Usually your time frame will be dictated by however long your grant is. Okay, and so I wrote these up. The book doesn't actually write these into objectives, but I wrote a couple of examples of how you would take this information and write it into an objective. So example 1, reduce hunger for 3,000 residents per year in Allison South Side. Or another way to write this up, and you might write both of these up as objectives, provide 4,000 meals per year to hungry residents on Allison South Side. So again, if you will look at this and jot down direction of change, area of change, target population, degree of change, and time frame. And then maybe we could take, do we want 10 minutes? Was 10 minutes enough time, or do you need more? I'm gonna stop sharing for a minute. Was 10 minutes enough time in the group? Anybody?
Yes.
Yes. Okay, so if Sherry can help me put you back in groups, I think you can go back in the same groups because I think it's set up that way. So if you can go back into the groups for 10 minutes and you can do that exercise, which was, again, I'll say it again, direction of change, area of change, target population, degree of change, and time frame. Got it in show to get out of, okay. Sherry, are you there? Oh, okay. I see people are going back to breakout groups.
Yeah, I'm working on it.
Thank you.
Yeah, we have some new people that I have to get
Oh, okay.
admitted, so. Can everybody see their breakout groups? Nate, can you see? You're in group 1. Kimberly, yeah, there we go.
Yeah, they're leaving to go to Great Others.
Okay, looks like we've got everybody, except for Nate.
Well, we did pretty well.
Yeah.
Is she one of your employees or is she,
No, she's one of the community partners.
well, so I think 10 minutes would put them done at 12:34, right?
Yes, that's correct.
5 more minutes.
Sherry, does it give you a polling option?
Not that I see.
I always see it on my phone, and
Let
every
me
time
look.
it hit it, it says the presenter has not opened the poll.
Let me look at the other.
I was looking at that too, since I'm in presenter and that's what I'm getting to.
Where do you find polling?
Well, I've never seen it on my computer, but when I'm looking at my phone and it says
Yeah,
polling, so I don't. That's why I asked, do you see it on your computer?
I don't. I'm looking at all the fields at the top.
Yeah. Okay. Well, we'll just play with it later
Sorry.
because that may be like a quick fix for us as we're waiting to get access for
It could
that
be in
live
the initial
polling.
setup of the meeting,
Oh, okay.
that when you set up the meeting and it's not available once you start.
Yeah, it may be something. So we should look at that then.
All right,
If
I'll
there's an
look into that.
option to do our surveys at the end until we get, word from the other department.
Right.
We use that in Zoom. We've used that to even to vote, like in faculty meetings, like they use the Zoom polling.
Yeah, we've done that in some of the meetings I've done in Zoom as well. We usually send out a survey monkey, but I want us to be able to just do live surveys immediately after these presentations, just to increase
Oh, okay.
the participation of surveys. Survey monkeys, they kind of get lost in email because we get so many of them and it's really normalized
Mhm.
now. So I figured if we can do a live polling option, then we can
Mhm.
get those responses immediately, and then it'll probably be a way for us to just start more fast track incentives as well for doing the surveys.
We also, so there's this app called Kahoot. It's designed for multiple choice questions, but I use it sometimes when teaching students. Because through the pandemic, I had to teach undergrads through this, you know, format, a webinar format. So I set up a bunch of Kahoot. And so it's like a quiz question practice. And so, like we would go over some content and then you would present them with some multiple choice questions. And it was like a game. If you got the right answer and you got it fastest, you would be on the leaderboard. So I noticed the men in my class got really competitive with it too. But
I
like,
loved it.
but like, they enjoyed it and it like forced more interaction because like you have the app on your phone and then I was just running the program through the web. And so, every like they would get like 1 minute to respond or 30 seconds to respond. And then if they all got it right, then we kind of move on. And then if they didn't understand something, we spend a little more time going over it. But it kind of forced, and like students, like especially undergrads like that, they'll kind of like, if you're in a regular class, they'll like nod their head like they understand, but then they don't.
Yeah.
And then it kind of brings it out, like when they don't get the right answer. And you're like, okay, so we do need to
Exactly.
go over this again.
I took a training, I think it was in February, about
We're back.
virtual training, how to get
I
people.
see that. How to get people what?
More engaged. So they were giving an example like what you just gave with Kahoot. So I like that.
I mean, that worked. I mean, for undergrads, that worked really well. Because I struggled. And then later I had content that didn't work as well with that. And because I've had struggles now with certain students, I've had struggles even with breakout sessions with getting them to participate. It depends on the student body. Because if they're just turning it on and walking away, then they're not going to participate. Okay, welcome back, everybody. Hello. I like seeing the cameras on. Everybody turned them off like as soon as they came back to the big group. I got somebody back on. All right, so I'm gonna go back to I'm on the wrong screen there. And back into this. So did one of the groups that was really chatty, like, oh, you know what? No, I can't do it that way. I hate this because you can't see it as big. But if you want to talk through your example, I can actually type it in right here. So does anybody have an example where they did the direction of change, area of change, target population, degree of change, and time frame?
Sure thing. We'll go. We'll go first this time.
Okay.
And then all together we can make a cohesive objective 1 and 2. We
Okay.
use the same example of Plus Memphis, using transportation to get those living with HIV to support groups. And so the direction of change is increase the number of support groups attended. The area of change is the Memphis TGA. The target
What does
population.
TGA stand for? I'm sorry.
Oh, that would include Arkansas and northern Mississippi.
It stands for
Okay.
Transitional Grant Area.
Was it try what?
And Transitional Grant Area.
Okay. And go ahead, next part.
And so for the target population, it would be individuals impacted by HIV, and that includes loved ones, family members, and caregivers.
I like that term. Yeah.
And
Okay,
later we
and then-
use support members to include those that aren't the individual that is living with HIV.
Okay. And
And
the degree of,
oh, sorry. The degree of change is support group meeting every 3 weeks at the hosted site. And we did quantify it. 10 patients and 10 support members attending every 3 weeks.
and then the time frame.
We just said 1 year because that would be
Okay.
at least a meeting per month.
I can't get this to work because I've got. Oh, wow. Well, we know it's 1 year. So I can't, like, actually what I need to do is go back over here. Stop. Let me stop share. And I think there's a whiteboard. We were playing with this yesterday. So that way you can. There's whiteboard. Oh, it's under the share. Hold on. There we go. Okay, so you can go ahead and do your objectives.
Okay. I'm trying. Do I have to hit the T on the side? Everything's grayed out.
Oh, no, you can just, I'll type it for you. I don't know if
Okay.
you can type on it. Everything's grayed out. Maybe only the presenter can type. Do you want to read it out and I'll type it?
Sure thing. So the objective, Ace, let me know if I'm getting it right. The first one that we would say would be 20 patients attending support groups at least every 3 weeks. Transport it to support groups every 3 weeks.
Oh, no, apparently you can't do that. Can't type over. All right, let me see what I can do. Let me start again. Let me just erase and start over.
Yeah. And I guess we can be more specific now. We use the term individuals impacted by HIV.
20 individuals impacted by HIV transported to support groups once every 3 weeks for a year. Okay, now we do have a danger here that we're just talking about fidelity to being in a support group, and we need to think beyond just the participation to what changes in their life as a result of being in a support group. But maybe that's in the second objective. So go ahead and tell me the second objective.
Well, Ace, I need you on this one.
Okay. Well, I'm kind of interested into what you were going to talk about, Miss Susan. I think that might be the area, the direction we were trying to head.
Mm-hmm. Well,
So
so
go ahead.
this measures fidelity to whether or not people are doing the intervention. But ultimately, we want to know, what do we ultimately want to change in their lives? These 20 individuals, if we were truly successful, what would change in their life? Would they be, would they get to undetected?
Yes. So
Yes.
it would be, so the first one would be revised, and it'll be 20 patients who are not undetectable. And so the second objective would be to get those 20 patients to be undetectable.
To convert to undetectable. You know the lingo better than I do. Okay, so ultimately our goal is, did we get people to undetectable? So we always want to think about, can we focus on that more significant outcome? And also, if this is a 1-year grant, can we get people? I think the answer is yes, but can we get people within a year to undetectable? And you might want to think about a measure that is, and help me out here because I'm not an expert on HIV, but there's a measure that we could have between just, are they undetectable, yes or no? Did we reduce, is it reduce their viral load? Did we increase, what can we do that's kind of between this, moving them all the way to undetectable?
So, well, yeah, decrease in viral load would be I guess we're looking for the in between.
I'm just thinking about if it's perhaps not possible to get all of these people to undetectable, and we don't want to overpromise, because I don't know if, am I wrong on this? It's not possible to get every single person to undetectable even if they do everything right. Is that correct?
Correct.
Yeah. So maybe that's a little bit too ambitious for an objective. So 20 patients will see a decrease in their viral loads. So we go that direction of thinking, so 20 individuals impacted, or so I'm just going to keep typing. 20 individuals who are impacted by HIV will see a decrease in their, go to the next line, viral loads as a result of participating in the, and what was the name of the program?
Yes, ma'am. Plus Memphis.
Plus Memphis program. So something like that. So, I mean, I think that's even more measurable. Like, so on all of this that we've written, we've got multiple objectives coming together here.
I worry,
so you would,
sorry.
Go ahead.
I worry about the measurement. If we're looking for a decrease in viral load, we included support members in the number of people attending the support group. They
Right.
may or may not necessarily be living with HIV.
Okay. So then we would need an objective that is related to people who are living with HIV, and then the other people impacted by HIV who, what do we ultimately want to, what's the ultimate benefit we want to see for them? Is there, there's measures out there of things like caregiver burden. There's measures of, you see, I don't have the answer for you, but I'm thinking kind of out loud in the brainstorming direction of what could we do in terms of measuring for them.
I guess. Hold on, yeah, caregiver burnout. Hold on, I'm thinking as I'm talking.
Yeah, I understand. So this is the process that you have to do, right? So
Mhm.
you want to come up with things that are measurable, that are making an ultimate impact on the community. Now, I mean, all of these ideas could potentially be the outcomes in your grant. So we could have, successfully transported to the, and, we could have 90% participation, a goal of 80 to 90% participation in the support groups. And that could be, that could be one of our objectives around participation. And one about, for the people who are living with HIV, we could see a decrease in their viral loads. And then for people who are impacted but not living with HIV, perhaps an objective around caregiver stress and caregiver burnout or something like that. And so, so we want to, like, as we kind of think about what this program can do, I want to think about incorporating all of these different objectives. And in going back to that original example I had about what did we buy with this grant, what did the money buy? A grantor is going to want to say, oh yeah, we want to keep funding this because it's actually helping people decrease their viral loads. And we've got all these people to undetectable now who were not undetectable prior to starting this program. And your point about, like, the other thing you have to consider is, are you going to be able to measure, if people participate, are you going to be able to get the measurement of their viral load? Is this a project where you have the right people collaborating to where you could actually get that measurement? And if it's not, then you won't be able to measure that outcome. But like, think through all of those challenges and all of those difficulties, but also think towards, how do we show that we've made the most impact? And we're running out of time. Does the other group want to add anything else here to their thinking about this process? Maybe, did you have some objectives that you wrote? Okay, well, let me just, because we have 12 minutes left. So let me go back to my presentation. I'll just tell you about, they're going to send, here, let's do this exercise. And so this is an example for a one-year career education course for unemployed adults. And this is from one of the two books that I used. And like, one of the quiz questions, this is kind of a quiz at the end, and they want to know whether these objectives are realistic or unrealistic for a one-year career education course for unemployed adults. So the first one, 90% of participants will have created a resume by the end of the year. I guess you could just say in the chat if you think that that's realistic or unrealistic. Unrealistic. And why would that be unrealistic?
Sorry, I think it would be unrealistic because 90% of all the participants in year one, you may have some challenges with programs or Wi-Fi or understanding how to lay a resume out or just different things, skill sets and levels. So I would think that's unrealistic.
Okay, so maybe it should be 70% or something like that. So presumably if you were working in the setting, you would know your population and you would know what would be a realistic goal. Participants in the program will attend an average of 85% of the sessions. Okay, so let me just say, since we're running out of time, they said that all of these were realistic except for the third one, which is 60% of participants will remain employed for 3 years after the program ends. And that's they considered unrealistic because you only have the grant for 1 year, you're only measuring for 1 year. But you know, with the second one, again, 85% might be too high. You know, your population, you might want to set it at 70% or something like that. And then the last one, participants will show improved attitudes towards work after completing the year-long course. And that sounds very realistic. And then again, that's where you're thinking about a pre-test, post-test, where you're measuring their attitudes at the beginning of the year and measuring them again at the end. So it is 12:51 and I'm out of time. So they're going to send out these slides and I put in here some terms you want to know, activities, outcomes, outputs, measures of success. And then I put in a few slides about logic models because often enough grants will ask you to write a logic model. And so this is the classic organization of a logic model: inputs, activities, outputs, and outcomes. And then I put in my own sample, which you can see is huge, but this is what this particular grant wanted for a logic model. They wanted 7 categories: goals, assumptions, inputs, target population, activities, outputs, and outcomes. This was something I was actually editing at the very last minute before we submitted because I went back through the rubric. That's another thing about writing grants, especially if you're writing federal grants, they're grading you on a rubric. And so you want to go through that information that those reviewers are using and make sure you've hit all of the points so that you get all of the points when they review. So literally at the end, they had changed this a little bit from the last time and they had added more categories. So I was going back in and redoing this and adding more categories and trying to make sure that it still fit on a page, because their requirement was that it has to fit on a page and it also can't be smaller than 10-point font. So anyway, but you can see the idea here. They wanted the goals in the logic model. They want the assumptions, the inputs, which were for us, the faculty who are training, the partnerships with community-based agencies, and the graduate level curriculum for the students in the 4 graduate programs that they're under the target population, the students who are in the 4 graduate programs that are part of this training grant. And then here's our activities, our training sessions, the practicum or internship, and the other activities down here. And then the outputs. Outputs are the products. So it might be, you know, a video, it might be the people that you trained, it might be a training curriculum, it might be a video about the program as a result, and then the outcomes are actually what changed. And so you can see we actually had, I think, 7 outcomes here. But anyway, I put in another slide here with some examples that you can go to the web and look at logic models if your grant requires a logic model. This resource from the CDC is really great and runs through a bunch of different samples of logic models. I also have some more slides about the steps and evaluations, and we're really running out of time. But just again, to the point that you really want to make sure that your objective lines up, your evaluation plan lines up clearly with your objectives. So in my example of improved trainee skills and working in interprofessional healthcare teams. We're going to directly measure that with the team skills scale, since we want to care about whether they can work in interprofessional healthcare teams. We're going to use the team skills scale, which is directly related to that. Can you work in interprofessional teams? Our design was pre-test, post-test, so we gave them the team skills scale before they started the training, and we gave it to them again at the end. And then our analysis is a plan that can show, did we have a improvement in those skills? So you could use a t-test, and we most of the time we're using repeated measures ANOVA. Okay, I really think I'm out of time. But I wanted to, well, this last slide, when you're planning your evaluation, make sure that all your objectives will be evaluated. So once you finish writing those objectives, make sure you have a plan to measure. Make sure that there's a plan for monitoring every 6 months or every year to make sure that, you know, you're effectively making, you know, monitoring those objectives. And of course, make sure the writing is clear. These are the two books I've been mentioning over the past hour and a half. And so I think that Sherry and Aisha are going to send out this information to you. And so they have the ISBN numbers here. I got them both from Amazon, and they're priced not as textbooks, they're reasonably priced. And then here are some websites that I recommend. And this Candid site at the bottom, I used this when I was teaching the grant writing course, because they had a lot of, like, they'll have sample budgets for you. They have sample letters of intent. And so it's a really good, they have a couple of full grant proposal samples. And so I really like that one. All right. And then questions, Krista has a question, how many sessions are there? So
Well, that was just when we were trying to see if it was realistic or unrealistic. I need to know the number of sessions before I know if it's realistic for how many students.
oh, okay, good point. Thank you.
It was a great exercise though to get those things figured out. Thank you.
Yeah. Well, anybody have any other questions or anything else?
No,
I
thank you.
enjoyed it, y'all. Huh?
This has been great, especially for me using my example. So this has been great.
Yeah, definitely. No, it's much more, it's like learning is always more effective when you're like doing instead of just listening. Yeah.
This was really great. Thank you so much, Susan. I am going to have to admit that this was like my top 3, very close to number 1. I love the way that you have had everyone engaged in the breakout rooms and everybody bringing the work that they're doing to the fold by working through the examples that you all have given. So like she mentioned today, we will send out the link along with the slides. If you have any additional questions, I know a lot of times we may have questions after the fact, then feel free to email myself or Sherry. And I would imagine that if it's okay with you, Susan, we can just share your contact information afterwards if people have some direct questions to ask you. Since we had to kind of push through the end of it, maybe we need a little bit more time. But I've enjoyed this, and I hope everyone received everything that they need out of this session, and we hope to see you on the next go round. So thank you so much. Have a good day.
All right. Thank you very much.